Is it okay if I move this?
Oh, yeah.
I know all this.
Okay.
Give me a thumbs up when you're ready.
Just don't roll any farther either way.
Thank you.
Can we get a mic check first, just a moment?
Sure. Matt Kelly, Kelley, Gallatin City County Health Department Health Officer.
Good. Cindy Spinelli, Communicable Disease Program Manager.
Tell me when you're good.
I'm good.
Okay. Thanks for being here on your Saturday. On Friday evening, the Montana Department of Public Health and Human Services and Gallatin City County Health Department confirmed a case of 2019 novel coronavirus in an individual residing in Gallatin County. The person who tested positive is a male in their 40s. Immediately, staff from Gallatin City County Health Department contacted the individual to discuss exposure that he and his family have had with the public. The individual was extremely cooperative and confirmed that he and his family have been home since his arrival in Montana on Wednesday evening. The individual was tested on Thursday and results came back positive on Friday evening. Here's what we know now. The diligence of the individual and his family in staying home while symptomatic prevented exposure to the public. The individual's brief time spent in Montana and conscientious efforts to stay at home has resulted in no identified local close contacts of concern related to this case. There's no indication the individual or his family had contact with any sensitive places, such as long-term care facilities or large public gatherings. Health Department staff will continue working with the individual and his family to ensure they safely maintain isolation and quarantine in their home until they are no longer at risk to spread the disease. Based on what we know now and the timeline of events, Health Department staff believe this person contracted the disease outside of Montana. As I said yesterday, nobody wants to hear a new disease is present in their community, but it's important to stress the facts here illustrate why it's so important that everyone follows some basic advice. Number 1, stay at home if you're sick. Number 2, wash your hands frequently, eat nutritious foods, drink plenty of water, and sleep. Number 3, be kind and compassionate. We are likely to see more cases and more people with mild symptoms isolating at home. They may be our neighbors, our friends, our colleagues. If so, reach out to them for support via text, email, or phone call. I can't emphasize enough the importance of staying home if you are sick. Our first case in Gallatin County followed this advice and likely saved the community from exposure to the disease. Ask yourself, do you want to be the person who exposed dozens or hundreds of other people to COVID-19? Or do you want to be the person who stayed home and helped us bend the curve of this pandemic by preventing new cases? With that, I want to open it up to questions from the media.
Do you guys have any idea as to where this individual traveled internationally, or can we not release that right now?
The individual came here from Europe.
Do you know what part of Europe?
We do, but we're not disclosing that right now.
Do you know if the other 3 cases in Montana were related to international travel, or were those?
Those questions would have to go to the state health department or the health departments that are managing those cases. We're just dealing with the one in Gallatin County right now.
Are there any precautions being taken out at the airport?
So the individual, what we have done is we've already been in touch with this state health department. We've provided the flight number that the person came in on Wednesday evening. That the nice thing about that is we have existing communicable disease protocols in place. We're used to doing that with less high profile communicable diseases. What happens next is the state health department will work with airlines, identify individuals who are within a certain radius of the family when they flew in, and then the contact investigation will continue from there.
Are you sharing where in Gallatin County this individual resides?
No, we probably won't in the future either. We're just saying that it's a Gallatin County resident.
Are there any other individuals that you're talking to, like related, who?
Yeah, there's individuals in the family, all the individuals know that they have to stay in the home, and all the individuals will be tested.
And those other individuals, did they have any sort of contact with schools or senior living facilities?
No, nobody in the family had any contact. They were really good. They went and they got home and they stayed home.
So that entire household is self-quarantined?
That's right. And that's going to be what we're probably going to see a lot of going forward as we get cases. We know that this disease tends to cause mild symptoms. Not everybody who has this disease is going to need to be hospitalized or in a care facility. And so we're going to have people quarantining at home. We're going to work really hard with those individuals and with those families to make sure that they have the support to stay quarantined. And so they know that they can call us for just about anything that they need.
I know this is an evolving situation, but post-quarantine, what are the steps to be taken at home, cleaning-wise, to ensure that the disease doesn't spread?
You want to talk about that so they don't have to listen to me anymore?
Yeah. So it is a new virus, but it's actually not very strong. So you can kill it with your everyday cleaning materials, something with bleach or alcohol. You just need to do that for your sheets, your towels, wash it in warm water, put it in the dryer. You don't have to throw them away or burn them. Just the common sense things you would do after someone had the flu in your house. Same thing for dorms and other facilities.
It's also really important to point out, I know people are having a hard time getting hand sanitizer. Good old-fashioned soap and water does the trick with this virus. It really does. And so we really encourage people to be careful. There are some families out there that need that hand sanitizer. Buy what you need, and also know that just old-fashioned soap and water and some time spending washing your hands does the trick.
Can you have the flu and COVID-19 at the same time?
It's unlikely.
So my understanding.
Yeah.
Go ahead.
So with these cases are presumptively confirmed, so that means the CDC has to confirm them right before they're officially. How long does that generally take?
I don't know, and to just let you know, from a local level, we don't wait for that CDC confirmation to do everything we would do anyway. So it's really a state CDC question.
Sure.
But when we get just erring on the side of caution, when we get a presumptive positive, we're treating it exactly like we would if that word presumptive wasn't on there.
Okay, sure.
What's the most important thing you can stress to the community now that we do officially have it in the state of Montana?
I think what I said before about staying home if you're sick, and I think thinking really, really hard about going out and being amongst large groups. We're not issuing guidance right now, any specific guidance about group sizes. We know that there are a lot of event organizers who are taking some really responsible actions and either postponing or canceling their events. And I think people being smart about their own health conditions and making decisions based on their personal circumstance and reducing exposure where they can. It's a good time to maybe catch up on your binge watching at home these days. That's a good thing to do. It's a cold weekend. Go ahead and do that.
Is that what you would call social distancing then? There's a lot of terms I guess we're seeing on the internet a lot. What does
social distancing takes a lot of forms, but that would be one thing, staying home and not attending those large events. The other thing is just having space between you and others when you're in a setting like that, not being packed in like sardines.
The guidance from that comes from when they look at the virus, when someone's coughing or sneezing, that it doesn't spread very far. It's about 6 feet under the best circumstances is as far as it can spread. So luckily it's not like something that can stay airborne. So that's why there's that guidance.
So I understand that this person had limited contact with the public, but what's the protocol or the steps that are taken to contact the people who maybe come in contact with someone who has a confirmed case?
Want to talk about that?
Yeah. So with every communicable disease that's reportable, we have different definitions on what's a close contact. And so the first thing we do is interview the person and then talk to them about what a close contact is. And that's usually based on proximity, time of symptoms, and then go through and contact those people. So this is exactly what we do for STD follow-up, measles, mumps.
Okay.
Yep.
I want to say the other thing I want to say for a moment is our healthcare providers in this community are working really hard. And I would ask the people, we know that there is stress about this and there's anxiety about this and there may be some frustration about this. Our healthcare community is really working hard to serve everybody and to provide everybody the care that they need. In this case in particular, the healthcare staff did a great job putting in place the PPE, expediting the time that the individual was in the clinical setting to the point that we don't have any contacts of concern in the clinical setting. That's really important, and I want to spend a minute for people to think about what healthcare providers are going through right now and be understanding, because their phones are ringing nonstop and they're doing the best that they can. And so I think having a bit of grace and a bit of patience with them as they go through this. When people have mild symptoms, it's also wise to keep in mind that often what you're going to end up doing is isolating at home, getting rest, drinking clear liquids, and just trying to get better. There's no magic pill. There's no vaccine that you're missing out on. So if you have mild symptoms, surely contact your healthcare provider, but have some patience and know that they're working really hard to make sure that we're serving everybody. All right, everyone good? Thank you.
Thanks.